Hello, ako po si Doc Bien Nilios, isang medical doctor, isang municipal health officer, isang public health practitioner, isang manggagawa ng gobyerno. At ito po yung time capsule ko. 1 year since the time na nagdeklara ng pandemic or ng pandemya sa COVID-19. So, today is March 17, 2021. So, it has been a year since COVID-19 uh, was detected in the Philippines, and the Philippine government started declaring, when the Philippine government declared a state of public health emergency dahil po sa dumadaming kaso ng COVID. No? So it's been a year na po, and ano po yung mga lessons that I have learned in that 1 year bilang isang doktor po? At hindi lang po doktor, isa pong doktor na nagtatrabaho sa public health po, sa komunidad po. No? Hindi po ako nakabase sa isang hospital, ako po ay nakabase sa isang munisipyo at ako ay may hawak ng municipal health office. So lahat po ng public health programs po, hawak po namin at ini-implement po namin. Kabilang na dito yung disease surveillance, yung mga interventions para ma-stop yung transmission o yung paglaganap ng COVID-19 virus. So, mag-iisang taon na po. Yung bayan po na pinagtatrabahuan ko po ay sa bayan ng Ilog, Negros Occidental. Dito po ako nagtatrabaho. Yung bayan ko po ay merong 15 barangay at higit kumulang 60,000 people, yung kabuang populasyon ng bayan ko po. Ito po ay isang rural town na located sa south ng Negros Occidental. May coastal communities po siya at meron din siyang mountainous communities. So varied po yung terrain niya. At karamihan po sa mga tao dito ay mahihirap, no? I am not really I cannot really recall how much percent yung nasa below poverty line, pero pwede nating sabihin doon sa significant number of the population that are living under the poverty line. At wala namang masyadong businesses dito maliban sa mga maliliit na mga food installation, restaurants, mga karinderya. Meron ding mga malalaking restaurant lalo na sa malapit sa coastal communities kasi doon din po pumupunta yung mga turista at mga bisita po. Gusto po nilang matikman yung popular na seafoods namin, yung aming mga crabs at saka oysters, no? Yung talaba, at saka tawag namin dito mga alimango, no? So, at iba pang mga seafood. So, kaya po dun sa malapit sa coastal, may mga malalaking restaurants doon at saka resorts. So, yun lang po yung karamihan sa negosyo dito. Of course, yung iba po mga ibang mga buy and sell, yung mga ganun po. So marami. So it's a mix of middle class and relatively poor communities po dito sa bayan. And nung last year, maalala ko, yung last year, uh, as early as February, nakakatanggap na kami ng reports galing ng Maynila through media and through advisories from the Department of Health tungkol sa mga kaso ng mga Pilipino at mga foreigners na nakapasok sa Pilipinas at na-diagnose na merong COVID-19. No? Naalala ko last year, 1 year ago, January, February, I was personally not so concerned yet. Kasi akala ko talaga hindi makakapasok yung virus sa bansa natin. Katulad ng SARS, no? If naalala niyo po, a few years ago, sa panahon yata ni President Gloria Arroyo yun, nagkaroon na ng isang outbreak of SARS din, no? Severe acute respiratory disease syndrome, no? May SARS virus din na nag-outbreak sa Asia, no? Pero hindi tayo masyadong natamaan ng SARS noon, no? So akala ko yun din yung mangyayari sa atin na hindi tayo matatamaan. We can stop the coming in of possible threats sa bayan natin. And besides, we are an archipelagic country, no? We are comprised of many islands, no? Separated by the bodies of water, no? So, hindi masyado ganun ka ika nga free-flowing yung movement ng tao, no? Because kailangan mo pang lumipad sa eroplano, sumakay ng barko, no? Para lang makatravel ka from one province to another, from Luzon, even Visayas, no? Especially Visayas Islands. The entire Visayas region is archipelagic, no? Kasi Visayas Islands. Unlike Mindanao, for example, of course, meron siya mga maliliit na mga islands katulad ng mga nasa Tawi-Tawi at nasa Siargao, yung mga ganong islands po. Pero yung kabuang region ng Mindanao ay iisang island. No? Iisang malaking island. Well, katulad din ng Luzon, no? Karamihan sa area ng Luzon ay iisang island. One big mass of land which is Luzon Island, no? Although meron siya mga iba-ibang mga maliliit din or islands din katulad sa Masbate, no? Romblon, Palawan, and other islands in the Bicol region, no? Pero the entire Luzon area is somehow, and of course sa Batanes, no? Batanes north, the entire Luzon area is one big island. So I really thought na yung Visayas, especially Visayas, well, yung buong Pilipinas, I really thought we have an advantage. Kasi we are not attached to mainland Asia. We are an archipelagic country. So I really thought our government could actually nip it in the bud, no? At kaya nating pigilan. But unfortunately, despite the information from other countries, no, my personal opinion here is we really did not take it seriously right from the start. No, I think all of us were guilty of it. No, but I think our government really did not take it seriously, and I guess a lot of responsibility falls on government kasi po sila po ang nakakatanggap ng maraming impormasyon. And kung ikukumpara mo yung impormasyon na nakukuha ko bilang isang individual, bilang isang medical doctor, yung impormasyon na makukuha, yung intelligence na makukuha at scientific data na makukuha ng gobyerno natin, ay di hamak mas marami at mas bigger picture yung tingin nila at mas more complete picture yung tingin nila doon. Kumpara mo naman sa impormasyon that would trickle down to individuals like you, like me. So I really thought na kayang pigilan ng gobyerno right from the start. Kasi we know naman kung saan nanggaling yung virus eh. Obviously, nanggaling siya sa labas. So, I think it's really common sense to say, bawal tayo magpapasok ng mga tao galing sa labas hanggat hindi natin screen kung sila ay may bit-bit na COVID-19 virus, di ba? Yun lang naman. I think it was really very common sense. And you don't need an expert in epidemiology. You don't need a specialist to tell you that. It's really just common sense, no? But like I said, in my opinion, our government did not take it seriously. The threat, I mean. Hindi nila sineryoso yung threat. Kaya medyo hindi masyadong mabilis yung response. Hindi na feel yung sense of urgency and sense of impending danger, no? There was no sense of ganon. So kaya, despite some advices from other sectors, hinayaan pa rin natin na pumasok yung mga ibang turista o yung mga ibang Pilipino na galing sa labas without really properly screening them. So yun, na-report na yun, and then when Metro Manila started reporting transmissions, no, local transmissions. And by local transmissions, I mean yung virus ay napapasa na from one person to another, no? Hindi na siya nako-contain sa iisang area, no? Lumabas na sa hospitals, no? Lumabas na sa mga ibang cities sa Metro Manila. And I think March 15 last year, President Duterte, I think in a nationwide telecast, pronounced that the government is putting Metro Manila under lockdown. No? So that was the first pronouncement with regards to COVID-19. No? So when Metro Manila went into lockdown, all other provinces followed as well. So a few days later, I think one day later, Negros Occidental Province also declared to place the province under quarantine. Ibig sabihin, bawal po pumasok yung mga galing sa labas ng probinsya in whatever way possible. It could either be via air, land, or sea. No? So nag-lockdown din, nag-fence, binakuran din natin yung probinsya natin. No? Because we wanted to be safe. We wanted to make sure na yung mga pumapasok po ay kontrolado natin. And because of that, because Ilog ang bayan natin is part of the province of Negros Occidental, we also followed suit. No? The mayor called for a meeting of all sectors and government agencies. We organized and we monitored what's going on in Metro Manila and in the province. In fact, even before Metro Manila declared lockdowns, ang munisipyo ng Ilog already issued a policy that for those coming from outside, no? Outside the country especially, kasi maraming mga foreigners ang bumibisita sa Ilog at this time of the year because supposed to be March is the fiesta, the town fiesta. And as early as February and even January, no? Or mas mga ganon, as early as February, January, March, marami ng mga foreigners, especially yung mga spouses ng mga residents galing abroad, they would bring their spouses from abroad to visit the town in time for the fiesta. But even before any pronouncement was given by Malacanang, the town already had a policy na pag merong mga galing sa labas, bawal po muna pumasok ng ilog. They are required to isolate themselves first, either in Bacolod City or in Kabangkalan City, which is the nearest city to the town. At doon muna sila magstay at mag-monitor ng kanilang sarili if they are healthy, if they develop signs and symptoms. At maraming din mga OFWs na umuwi nung time na yon. So even before Metro Manila went into lockdown, meron ng mga OFWs na umuwi ng bayan. So yung policy ng bayan was to isolate the returning OFWs in their houses. So we would place their houses on lockdowns, no? And because there was really no guidelines yet from DOH, we followed the medical evidence. Na at that time sinasabi it takes 14 days for the virus, for the incubation period of the virus. No, it would take 14 days for the virus to manifest itself. In fact, meron nga mga information before na even more than 14 days ang kailangan for the virus to manifest into signs and symptoms like cough, no? Even diarrhea, meron mang ganong symptoms before, no? So, ginawa ng bayan, nag-issue kami ng policy na lahat po ng umuuwing OFWs or galing sa labas ng Pilipinas at umuwi ng ilog, regardless of their length of stay in Ilog, regardless of their purpose for their visit in Ilog, they have to put themselves in isolation in their houses, sa bahay muna nila. Policy po ng bawal gumala yung mga galing ng abroad, whether foreigner or OFW, kailangan po muna nilang mag-lockdown sa kanilang sariling bahay, sa kanilang uuwian dito sa bayan natin. So, yun po yung nangyari 1 year ago. So, this was all done even before po nagdeklara ng lockdown yung national government. So, even that, nauna na po kaming maglagay ng mga lockdowns, no? So, and then of course, when naisip ni Mayor na, naku, baka mas marami pang uuwi. So baka we have to put up our own quarantine facility. So kaya po nag-construct yung bayan ng Ilog ng mga bungalows sa isang lote na medyo may kalayuan sa mga ibang sa bahay, pero malapit sa sentro para mas mabantayan po siya. So mga bungalows at ginawa siya ginawa siyang quarantine facility. So it started with 3 at nag-expand at naging 4, 6 bungalows. But of course, wala namang masyadong malaking budget yung bayan, no? So that's why when DOH already started issuing guidelines, no, requiring that the LGU must identify or designate certain areas or buildings as quarantine facilities, no? Nag-coordinate yung bayan with the Department of Education if we can designate and use their schools, no? Kasi po sinuspend po all face-to-face classes were suspended, so the students had to finish their school year online, something like that. At naging modular na rin yung DepEd. So laking pinsala talaga ng virus sa atin lahat. So with the partnership through the partnership with the Department of Education, the municipality identified schools per barangay to function as designated quarantine facilities. So we have 1 quarantine facility for each barangay po. So that po kung yung isang tao na uuwi sa bayan, is an original resident of a particular barangay, doon po siya i-quarantine malapit sa barangay na yon para mas madali yung pagbantay po. And of course, ang barangay, through the barangay tanods and the barangay health workers, ang naging bantay at staff na nagmo-monitor doon sa designated quarantine facilities, no? Of course, from March to April to May, halos hindi na ako nakauwi because di na ako nakauwi ng bahay. Doon na ako natutulog, dito na ako natutulog sa rural health unit ginawa ko na tong bahay because of course kami po ay exposed sa maraming pasyente at ayaw ko namang dalhin yung virus sa pamilya ko. So we had to quarantine ourselves din dito sa main municipal health office ko po. Tapos yung Bacolod City naman kung saan nakatira yung pamilya ko ay nag-lockdown din. So of course all borders are being regulated by the Philippine National Police. Hindi ka makakapasok kung wala kang kompletong dokumento kasi bawal yung travel, no? Unless kung ikaw po ay isang health worker, isa po kayong frontliner, pwede po kayong magbumiyahe. Especially kung galing punta kayo ng office nyo or ng workplace nyo, pwede po. Pero hanggat naka-community quarantine, enhanced community quarantine ang tawag doon, di ba? Community quarantine na in-enhanced pa, di ba? So, yun, bawal po sa daan. So naku, parang naging ghost town yung mga towns and cities sa buong Pilipinas at sa buong mundo. Last year, nakikita natin sa TV, nakikibalita tayo sa mga sa social media, halos walang tao sa daan, no? At last year, para din po ma-update yung mga kababayan natin sa munisipyo, nag-start po kami ng weekly live update sa Facebook, yung bayan namin. So I think every Monday afternoon, yung kasama ko pong Doktor to the Barrio, we put ourselves in front of the webcam and then we report kung ano po yung kung ilang PUMs, no? Persons under monitoring, persons under investigation, yun po yung mga terms na ginagamit before, no? PUM, PUI na. So nire-report po namin yan kung ilang PUMs ang nakapasok ng ilog, ilang PUIs ang nakapasok ng ilog, ilan po yung mga PUIs ang naka-admit sa ating quarantine facilities at hinahantay yung swab test. Kasi last year, wala pa po kaming kakayahan, no? Yung Municipal Health Office, we cannot buy swab test kits. We don't have the capacity yet to purchase swab test kits. So yung ginagawa namin, pag may PUI na nakapasok, we investigate, we isolate them, and then we ask the Provincial Health Office to send personnel to collect swab samples. And then so pumunta sila sa ilog. We had two cases of PUIs as early as I think April or May. So inadmit natin sa quarantine facility natin. Tapos pinuntahan po sila ng taga-provincial government, yung Provincial Health Office, para kunan ng swab specimen. At buti naman, their results came negative. So medyo matagal pa noon, no? Yung release ng results. I think mga 1 week or mga 5 days, something like that. So matagal pa. Hindi pa ganun kabilis. So of course, we were always sitting on pins and needles, hoping and praying na wala pang positive case sa ilog. Pero of course, at that time, naka-checkpoints naman yung entrance and exits ng bayan. Pero meron pa rin mga tao na nakakalusot. No? At pag nakalusot na sila, hindi naman sila nagpapaalam o nagre-report sa bayan o sa kanilang barangay na nakauwi sila. So galing silang Oriental, galing silang Cebu, yung iba galing Iloilo at nakakalusot lang o galing ibang bayan sa Oriental. Kasi yung Occidental at saka Oriental, both are in the same island. No? But of course, iba rin yung mga conditions sa kabilang part ng Negros Island. So yun, may mga ganong kaso. And we were very happy na from March to May, we were not reporting any positive COVID case. I think, if I can remember correctly, the first COVID case that we reported was in June. Yes. That was the first COVID case. Pero yung COVID case na yon ay hindi siya nakauwi ng bahay nila. Kasi pagdating niya sa ilog, nag-undergo kaagad siya ng quarantine sa aming quarantine facility. And at the time, may mga swab, pagdating nila ng Bacolod, pagdating nila ng Negros, sino-swab test na sila kaagad ng province. So, sinusundo lang sila ng bayan at hinahatid sa quarantine facilities natin. At doon sila naka-isolate at naghihintay na kanilang swab test result ng RT-PCR. No? But that was really very scary because we had to get the travel history of this patient, kung saan siya nanggaling, because you had to report it's a province. We also had to check kung sino yung mga staff, yung mga nakausap niya nung dumating siya habang ina-admit siya, sino yung mga nakahalubilo niya, kung nakahalubilo man, nakasuot ba sila ng PPE noon, naka-face mask, PPE talaga, full gear. Kung hindi po, baka kailangan ding isolate yung staff. So that was really one of the scary moments. Kasi first time yun eh. At nangyari yun kasi hinayaan na naman ng national government na umuwi lahat ng mga nakatira sa Metro Manila na umuwi sa kanilang probinsya without even screening them. So kahit hindi natin alam kung positive or negative sila, pinapauwi lang sila. O sige, uwi na kayo, bahala kayo, uwi na kayo. And obviously, pagdating dito, kasi hindi sila nasa screen ng Metro Manila, doon, authorities. So we don't know whether these people are carrying the virus. And true enough, because of that Balik Probinsya program, nag-spread yung virus. Kasi from March to May, most cases were just in Metro Manila. There were some cases being reported in Iloilo, in Cebu. Pero yung Negros, merong mga nakakalusot na cases, pero single digits lang. And usually, mga exported cases. Kasi galing ng Manila, umuwi lang ng Negros. At yun, na-report siya ng Negros. Pero hindi niya nakuha sa Negros. No? But nakuha niya from Metro Manila. And I remember May or June, si Panay Island, si Iloilo, si Cebu, they were reporting positive cases in double digits na. Whereas Negros Island, or especially Negros Occidental, we were just reporting single digits. So, habang yung mga ibang probinsya sa palibot ng Negros Island, tumataas yung COVID cases nila, Negros Island was somehow not experiencing the rise of COVID cases kasi nga nakokontrol yung borders. It was only because of this Balik Probinsya program of national government na naman. And ang problema pa sa national government, pag hindi ka sumunod sa national government, binubuli yung mga local government units. Sabi ko, akala ko may autonomy yung mga local government units. Di ba? Wala namang constituency yung national government eh. Hindi naman sila yung magbabantay ng mga tao sa probinsya. Okay lang sila magdakdak doon sa taas at mag-issue ng mga policy. Pero hindi naman sila mag-i-issue hindi naman sila magbabantay, hindi naman sila yung mamumroblema kung saan ilagay yung mga positive cases natin. So, in the desire to declog the overwhelmed healthcare system in Metro Manila, national government just decided, sige, yung mga hindi taga Metro Manila, yung mga gustong umuwi na sa kanilang original na probinsya, sige, uwi kayo. Kami po ang mag-arrange ng mga flights nyo pa uwi. Without even testing. So yun pa nga, naalala ko, maraming mga clamor for mass testing before. Because how can you control the virus
if you don't know where the virus is. You have to hunt for the virus. You have to search for it. At doon mo malalaman kung kailangan, kung to what degree or to what extent mo i-control yung spread niya. Baka kasi nakalabas na yung virus sa area ang kinokontrol mo. That's why you have to widen your perimeter of control. So the importance here is you have to find the virus. So kaya nga yun. So maraming mga clamor for mass testing, pero ang bagal ng gobyerno, ang bagal mag-procure ng mga swab test kits, ang bagal mag-approve ng mga laboratories na magkakandak ng RT-PCR testing. So national government was very slow in response. And this is a personal opinion, but that was my observation last year. So, because of the very slow response and because of the very politically motivated decisions, not anchored on any scientific or empirical evidence, lumaganap yung virus sa buong Pilipinas. So, naging balik probinsya, kalat pandemya program ang nangyari last year. So, from a very small case of around 2018, 30,000 positive cases, it ballooned to, as of today, more than 600,000 positive cases to record. And marami na rin yung namatay. Ang nakakaawa doon, yung mga unang namamatay ay yung mga medical frontliners pa. And these are medical frontliners in the hospitals. Hospitals, ha? Because ang nangyari, ginawang frontline yung hospital. Ito na naman. This is what happens if your policymakers are very hospital-centric. No? Mga hospitalists eh. Yung mga lahat ng mga experts na tinatawag nila dyan. I did not even see any public health expert. I'm not even sure if they consulted public health practitioners, municipal health officers. I did not even see a representative of the municipal health officers of the country sit down in one of those meetings. And, I did not even see if there's a health social scientist in the group to give man lang an opinion and analysis on the data that was coming from. So ano nangyari? Because hospitalist din, hospital-centric din yung mga experts na to, ginawa nilang frontline yung hospitals, which is really wrong. What do I mean when I say ginawa nilang frontline yung hospitals? Lahat ng investments nandun nakafocus sa hospitals. Hindi man lang napag-isipan, how do we halt the transmission in the streets, in the fields, in the mountains? Diba? What investment should we put in public health para mapaigting yung disease surveillance, ma-halt yung transmission, because only public health practitioners know this. Diba? So kanya-kanyang expertise yan eh. Pero mukhang naitsepwera na naman si public health at naging hospitalist focus na naman, naging hospital-centric. So anong nangyari? Maraming mga hospital doctors yung mga namatay. Some of them are very young. Some are already consultants. Oh my goodness. Diba? These are storehouses of medical knowledge. Nawala na. Because they're dead. They could no longer train residents. They could no longer train interns and clerks. So wala na. We lost our storehouses of medical knowledge. Kasi nga sila na yung nagiging frontliner, which should not be. So yun, maraming namatay, pero kahit marami nang namatay, marami pa rin mga Pilipino ang hindi naniniwala sa COVID. Nakakatawa nga eh. Maraming mga COVID-19 deniers. So, in denial sila. Mga conspiracy theorists. Kung ano-ano pang pinaniniwala ang mga misinformation sa social media. So, because they don't believe in the virus, they don't feel the need to protect themselves. So, mas lalong nag-spread yung virus. Maraming nagva-violate ng mga health protocols. Kahit nakalagay na sa community quarantine status yung lugar, marami pa rin yung lumalabas sa bahay nila. Kasi nga naman, yung mga areas na to, yun talaga eh. Isang lesson that I learned from this is, pag mga ganitong pandemya, yung mga mahihirap, the very poor, the very indigent, sila talaga yung unang-unang maapektuhan. They are always at a disadvantage. The odds are never in their favor. Yung mga mahihirap. Imagine lang, if i-lockdown mo yung isang barangay, so hindi sila makakalabas. Okay lang kung mayaman sila at nakabili sila ng mga pagkain, nakastock sila, nakastockpile sila ng mga food, ng mga iba pang mga pangangailangan sa bahay. So kahit hindi pa sila lumabas ng 2 buwan, okay sila. How about yung mga mahihirap? Wala naman silang ganong pera na pwedeng mag-stockpile ng pagkain, di ba? Yung iba nga on a day-to-day basis lang namubuhay. So it is the poor who is always hit the most in this time of pandemic. That is why ako, in case we return to what they call a new normal, dapat ayusin na natin yung poverty reduction programs natin. Ayusin natin yun. Huwag nating pag-isipan talaga yung mga poverty reduction programs. Mag-mapping tayo ng mga socially vulnerable sa community natin. At talagang yung attitude natin dapat, pag nabakunahan na tayo at nakasurvive na tayong lahat, dapat yung attitude natin, maghanda tayo sa susunod namang pandemya. Kasi, there will be more pandemics to come. There will be more pandemics to come. At yung kinatatakutan ko, yung mga dadating na pandemya will be worse than the current pandemic. Kaya nga po, dapat ayusin yung mga kailangang ayusin sa lipunan natin. So when we return to the new normal, our poverty reduction programs should be revisited and we should invest in poverty reduction programs. We should invest in livelihoods. No? We should help the poor somehow lift themselves up from this situation. Kasi po, if they will remain poor at maaabutan na naman tayo ng panibagong pandemya, alams na. Alams na. They will suffer. They will suffer. Kasi hindi naman pwedeng hindi mo isolate o mag-implement ng mga hindi naman pwedeng hindi tayo mag-implement ng mga quarantine strategies or protocols eh. Kasi that is one of the best strategies to stop the transmission of the virus. Hindi naman pwedeng ganon. So isa yan sa mga lessons learned. So, kailangan tayong mag-revisit, mag-reinvest in our poverty reduction program. Because poverty is a determinant of health. Alam naman natin, pag mahirap ka, you will always be at a disadvantage sa usaping pangkalusugan. So, in order to address this public health concern, we have to address also our poverty concerns. Their living conditions, di ba? Sasabihan mo yung tao to stay at home. What if wala siyang home? What if wala siyang house? Or what if sa house na yun, crowded sila? Eh, walang silbi din yung policy na yun. So, we really need a government that must have the foresight. Dapat may foresight yung gobyerno that we have to protect our citizens from the next pandemic. Kahit saan man manggaling yung pandemic na yan, whether outside the country or manggaling man sa loob ng Pilipinas, at least handa tayo. And when I say handa, hindi lang yung healthcare system yung handa. Dapat yung buong lipunan ay handa. Diba? I think that's one major lesson that I learned here. And I think we have an opportunity come 2022, 23, sa susunod na election po, mga Noipi, kailangan na natin seryosohin yung election. Dapat pumili tayo ng mga leader sa lokal, mapalokal man yan, mapanasyonal. Pumili tayo ng mga leader na merong ganong vision. Yung mga leader na nakikinig sa logic, sa reason, sa science, sa ebidensya. Yung leader na hindi lang mapolitiko, alam niyo yung ibig kong sabihin, yung leader dapat na willing siyang itaya yung lahat niyang political capital. Mailagay lang yung mga kailangang ilagay para ma-proteksyonan yung mga mamamayan. So kung sino man yun, nasa inyo na yun. Kayo na po yung mag-decide. Kasi po, kanya-kanyang yan kilatis ng mga tatakbo sa susunod na eleksyong pang-lokal, pang-nasyonal, kahit po sa barangay. Minsan kasi, hindi natin siniseryoso yung eleksyon sa barangay. No? Karamihan nga sa atin, hindi bumoboto pag barangay election. Pero, ako personally, doon ko rin nalaman na pag mahina yung leader sa barangay, talagang malulusutan yung barangay nyo ng COVID-19. Pag mahina masyado yung leader sa barangay, hindi. Malulusutan kayo ng COVID-19. So isa yan sa mga aral na natutunan ko sa 1 year ng pandemic na to. Sa ngayon, may mga bakuna nang dumarating, pero ang bagal pa rin. Diba? Ang bagal. Ang objective natin, at least 60 to 70% ng population ng Pilipinas ay mabakunahan natin laban sa COVID para lang ma-achieve yung tinatawag nating herd immunity. No? Pero with the rate of things, the way things are going, mukhang hindi natin ma-achieve yung herd immunity in the next 3 or 5 years. No. Unless government changes its strategy, changes its hastens policy. Ang problema kasi sa gobyerno natin, daming red tape. Ang daming red tape. Maliban sa ang daming politiko, ang daming red tape. So, at daming ding pasaway sa gobyerno. Naku, gobyerno na mismo, pasaway pa rin eh. Hirap kasi, pag politiko and political leader, they cannot help but decide politically. They will always be political. But ang problem is, this is not a political problem. This is a public health problem. So we should allow public health, we should provide public health solutions, not political solutions. Kung political crisis to, then I would agree, let the politicians work this out because this is a political crisis. But this is not a political crisis. This is a public health crisis. Therefore, we should allow public health solutions first. We should try public health solutions first. Because we all know that if a public health crisis is left unchecked, it will branch out to other crises. No? Public health crisis lang yan sa simula, it will end up as economic crisis. Which it did, di ba? Last year, we went into economic recession. Grabe, ang baba, no? Ng ano tawag doon? GDP, GNP, nakalimutan ko yung exact term. I'm not an economist, but the way I understand is it was one of the worst dips since post-World War II. Imagine all the economic gains that we had in the past 3 administrations, we lost in just 1 year. Lost. So, sabi nila, so we have to provide economic solutions. But you have to understand that your economic crisis now is because of a public health crisis. And unless you address the cause, the first cause, no? The cause of the first cause, the first cause of the cause, no? Whatever, unless you address the roots, you will always have economic crisis. So, you have to allow your public health solutions first to work. You do not skip. Problema kasi ng mga tao dito, nagpapanik tayo kaagad. No, you have to let your public health solutions work it out first. Try it out. Kasi mga tao, mga politiko kasi, natatakot, baka mabawasan sila ng boto sa susunod na eleksyon. Pag hindi na-address yung public health crisis na to, mababawasan talaga kayo ng botante kasi mga botante nyo, mamamatay na lahat sa COVID. Diba? So you have to allow your public health solution. You have to do public health solutions first. Secondary na lang yung mga ibang solution. They should not be the primary solutions. Because all of your crises now, economic crisis, social crisis, maybe peace and order crisis, other crises, no? All started with a public health crisis that is not yet addressed. We have not addressed, we have not solved the public health crisis yet. Oh, sabi ng Pangulo last year, antayin lang natin pagdating ng bakuna, giginhawa yung buhay natin, magagaan na lahat ng problemang ito. Oh, dumating na yung bakuna. Did the crisis go away? Not yet. Because the vaccine is not the only solution. It is not the only solution. Vaccination is not the only solution. We need to put some mitigating strategies na ma-buffer to give your vaccination some time to take effect. Kasi may time factor yung vaccination eh. It would require some time to take effect pa. So, while we're waiting for the vaccine to take effect, we had to do other strategies before, during, and even after the vaccination programs. At yun ang hindi ko naririnig sa gobyerno. So it's frustrating for a public health practitioner like me, for a medical doctor like me, for a Filipino father with 2 children like me. It is frustrating. However, kahit frustrating, kahit disappointing, kahit hindi kami agree minsan sa mga policy ng national, you still see us reporting to work, doing the best we can, just, addressing the problems here at the local level in the best way possible. But of course, let's give credit naman sa national government when they issued the Bayanihan law, no? It provided some financial support to LGUs. And because of that bayanihan law, we were able to purchase more supplies and equipments that would protect us when we expose ourselves to our patients. So, in fairness, the national government is doing its job. But I cannot grade it as excellent the way Malacanang graded themselves as excellent. I think there is still more space to do better. And it starts by admitting the fact that there were some lapses, there were some failures, there were stupid policies that basically facilitated the spread of the virus. So I hope our incoming months and years will be better. I hope national government would start listening, and I hope everyone stays safe. And I am hopeful that we will survive this. Tayo pang mga Pilipino, isa sa mga very resilient people in the world. And I think we will overcome. For as long as we continue to help each other and cooperate, despite how difficult it is sometimes, for as long as we are not selfish, we don't only think of ourselves, we also start to think of other people around us. I think we will be able to survive this pandemic. So that is my time capsule 1 year after the start of the lockdowns here in the Philippines. Iisang taon na po yung pandemya. Nasa pandemic period pa rin po tayo. Nawa po kayo po ay safe lang, ligtas. Pagdasal po tayo, manalig lang, at samahan po natin yung pananalig na yan ng aksyon at kilos upang mapigilan yung pag-spread ng virus na to, especially sa mga tao na vulnerable or mahihina yung kanilang kalusugan, at sila po yung unang maapektuhan ng virus. That's my take. Maraming salamat po.